So I'm going to talk about a lung cancer pilot awareness project that we did in North Dublin, and it's just finished. We just have the results in now. So first of all, why did we pick lung cancer? And we picked lung cancer because, as Patrick said, while it's our third most common cancer, it is our #1 cause of cancer death. Again, most cases of lung cancer are diagnosed at stage 3 or 4, and we think that if we could diagnose these people earlier, we would improve their survival or at least reduce the treatment burden for them. We also know that unprompted knowledge of lung cancer symptoms is poor generally amongst the Irish population. We know that less than half of all people know that a cough or a persistent cough, a cough that won't go away, could be a sign of lung cancer. And we know that less than half of people surveyed would go to a doctor as soon as they saw a symptom that could be lung cancer. Why North Dublin? Why did we aim for the North Dublin area? First of all, the epidemiology. The incidence of lung cancer is higher in North Dublin relative to other areas. It could be related to deprivation, as Patrick was saying. We know that North Dublin has significant areas of deprivation, and it has a somewhat older population than other parts of the country. We also felt that it was an area where there was service readiness. We have a regional cancer prevention officer there since 2022, and we have 2 rapid access lung clinics in the Mater Hospital and in Beaumont Hospital. So with that in mind, we at the HSE National Cancer Control Programme joined forces with HSE, CHO Dublin North City and County, and with HSE programmes and campaigns to pilot an early diagnosis of lung cancer public awareness campaign in North Dublin. So our key messages were this. We focused on cough. One of the commonest presenting symptoms of lung cancer is a cough, and that would be a persistent cough, a new cough, or a change in your existing cough. So we made that this key focus for the campaign on the basis of advice from HSE Comms, who said, one message, keep it simple, one symptom. The next part of the message was contact your doctor or contact a doctor if you have a cough lasting for more than 3 weeks. And that was the call to action. If you have a cough, contact your GP. So this was the plan for the campaign. It is a public-facing campaign. It was targeted, aiming at the same people that I think Patrick with screening will be aiming at, people who are older, aged over 50, smokers and ex-smokers living in a deprived area. It was a multi-pronged campaign comprising social media, print media and other methods. And we had a patient focus group to inform the design of the social media creatives and the out-of-hours advertising leaflets. So multi-pronged in the sense it was out of home, ads at bus shelters, digitowers and across areas of deprivation in Dublin. We had ads in pharmacy screens in a selection of pharmacies in North Dublin where we were allowed. We had press ads in the North Side People, social media messages across Facebook and Instagram, and we had community promotion. We sent a campaign pack to over 800 stakeholders in North Dublin. And finally, we had a website called checkthatcough.ie. So we did some research before and after the campaign, and this is what we did, how we approached it. We began with some surveys beforehand. We had focus groups to inform the design of the campaign material, and we had post-campaign surveys, and we will do other evaluations where we can to assess the performance of the campaign, and we'll evaluate the reach of the social media and other ads. This is the pre-campaign survey. Now, it was a small survey. It was 300 people all told. 150 in our target area, 150 in a control area. The control area was Tallaght, South Dublin. So there was a fairly even split in gender, approximately half male, half female, and the majority of people were over the age of 45, and a fairly even split in social class as well. We found that the majority of people surveyed would say that they are worried about getting lung cancer. A net 56% of people would agree that they are worried about lung cancer. We found that this was more common in people who were smokers, which is not surprising. 64% of smokers versus 34% of non-smokers would be worried about getting lung cancer. So I suppose you could say that there's something to work with here. Smokers know that they're at risk from lung cancer. No massive differences otherwise, be it social class or gender. We found that 45% of people were confident that they could spot symptoms, and this was very much like what we found in the 2020 lung cancer survey, where about half of people found that they felt that they would know the symptoms of lung cancer. The majority in the exposed area, this is North Dublin, the majority there felt that they would be confident in spotting symptoms of lung cancer. So then we considered the common symptoms that people felt would be associated with lung cancer. And these were the unprompted symptoms. So unprompted, and of course the first most common symptom, 47% of people noticed it, coughing up blood. And I think this is a problem straight away. I mean, this is true. Yes, coughing up blood is a symptom of lung cancer. And if you are coughing up blood, you need to check it out. But it's a presenting symptom in about 5% of cases of lung cancer. So you can't be hanging on waiting for hemoptysis before you get checked out. And it was a little concerning that this popped up at the top of the charts. Shortness of breath, just 38%, and then cough finally makes an appearance with just 25% of people noticing, thinking a cough is a sign of lung cancer. And actually cough and shortness of breath would be presenting symptoms in 2/3 of cases. These are the prompted symptoms. So when people are given a list of symptoms and asked, do you recognise symptoms of lung cancer? And once again, coughing up blood tops the chart. Everybody agrees coughing up blood could be a sign of lung cancer. Who would you go to see if you thought you had a sign or a symptom of lung cancer? And it was reassuring to see that the vast majority of people would contact their GP. 89% of people would go to see their GP. Which symptoms would trigger urgent action? Which symptom would get you moving if you had it to get to see a GP quickly? And again, you can see the pale blue there at the top. 72% of people say if they coughed up blood, they'd go as soon as they noticed it. And that's great, except that they're not likely to cough up blood if they have lung cancer. They're more likely to have a cough that's going on for 3 weeks or more, or they're more likely to have breathlessness. And we found that just 13% of people would go to see a GP if they had a cough going on for more than 3 weeks, for example. Why wouldn't you go to see a GP if you had a cough that was going on? Well, because you'd think it was a cold or a flu. And I suppose that's not unreasonable, but we really can't kind of have that. We need to encourage people to go and see their GP if they have a cough that's persisting. All the usual there pop up. I'd be worried about what they might find wrong with me. I don't want to be told to give up smoking, and so on. But worried it could be a cold or flu came out on top. And with that in mind, then we came up with these messages. A 3-week cough could be a sign of lung cancer. Contact your doctor if you have a cough lasting more than 3 weeks. We had our focus groups then, so they were presented with options for the campaign, and they tested 3 options that were presented to them. They felt that the option they went for in the end was serious. The quote on it resonated with them, and they felt it was true to life. They also felt that their children might see it, and that might encourage them to get checked out. These were the campaign assets then. You might have seen these posters floating around North Dublin, and they addressed the key messages. So a cough that lasts longer than 3 weeks could be a sign of lung cancer. Addressing that barrier, I really thought that 3-week cough was just a cold. And then the call to action, contact your GP or doctor and get that cough checked without delay. I hope this works. Now it mightn't, no, it's not going to work. Okay, this was our little man here. This was the social media.
I really thought that 3-week cough was a chest infection. A cough that lasts longer than 3 weeks could be a sign of lung cancer. Contact your GP or doctor and get that cough checked without delay. Visit hse.ie/check that cough.
So that's what went out on social media, and we got advice from HSE Comms that people in this age group this ad would reach them, that they were able to advise us as to where people in this age group source their information, and so we felt that that was appropriate for them. You can actually hear the little man coughing at the beginning, but of course I broke it, so you can't hear him now anymore. I cured his cough. So we had our pre-campaign survey, then we had our campaign, and then we had our post-campaign survey. So this is the post-campaign, and look, it's a bit rough and ready. I must stress that it's draft. It really did come in just very late last night, and I've tried to compare the pre-campaign information with the post-campaign. So you can see pre-campaign, 56% of people were worried about lung cancer. Post-campaign, it dropped, 42%. Now, maybe that's a good thing, maybe it's a bad thing. We are trying to say if you get picked up early, your chances of survival are better. So I'd like to think it's a good thing. We don't know for sure just yet. Post-campaign, the prompted symptoms, and again, hemoptysis is still coming out top of the charts. Everybody spots hemoptysis. But feeling short of breath has risen from 68% to 87%. So there's an increase there. A change to your cough, the recognition of that has gone up from 72 to 80%. 86%. Recurrent chest infections has increased from 73% to 85%. And the presence of a 3-week cough, recognition of that has gone up from 67% to 81%. And some of the more vague symptoms, feeling tired or having loss of appetite, it's good to see the recognition of those has increased as well. How soon would you seek medical advice? Strangely enough, it went down for hemoptysis, decreased slightly for a change to usual cough. But if you have shortness of breath or if you have a 3-week cough, somewhat more people are likely to seek medical advice within 1 week of those symptoms. The barriers to contacting a doctor, we know that pre the campaign, the commonest barrier was, I would think it was a cold or a flu. That was 63%, and that fell to 36%. I would think it would not be serious enough, which is very close to saying I think it's just an alcohol cold or a flu. That fell from 35% to 17%. The worry about what they might find fell from 46 to 25. And maybe that bears some relation to that overall figure of fewer people being worried about a diagnosis of lung cancer. And this is, actually that's 28%, not 2%, but people thinking it would just be a natural side effect of smoking has fallen from 43% to 28%. So people seem to be less likely to trivialise a cough. This is campaign recognition, and I know it's a very busy slide, but we did ask people if they recognised the campaign, if they saw it anywhere, and 10% saw the ad at a total level, and that was 13% of people living in North Dublin. There was good news concerning the advert, really. Most people felt that they understood it. It made them aware of the signs and symptoms of lung cancer. They felt it was helpful. It contained information in the ad that was new for them, such as, I suppose, that a 3-week cough could be lung cancer. 62% of people felt that the ad was relevant to them. Although there you go, 44% said they're fed up hearing and seeing ads about lung cancer. That's put us in our place. So again, in terms of the impact, 84% said if they knew somebody with a cough for more than 3 weeks, they would be more likely to advise them to contact a GP. 84% if they themselves had a cough for 3 weeks or more, they would contact their GP. And just 7% of people who saw the campaign did actually contact a GP. And we contacted the GP leads in North Dublin to see if anecdotally they had noticed any surge in activity, and they hadn't, not that they'd noticed, or no major impact anyway. And that's where we are. That's the result of the campaign. That's how the campaign worked. And now we have to sit down and think about it and think about our next steps. Thank you.